But that is yet again an example of what is seen every day in every community in this nation. There is a denial of coverage by the insurance companies, and for those who have no insurance, they face a situation where death, bankruptcy, and the loss of their jobs. It's not necessary. Now, you mentioned, we've talked about the cost in the system. Perhaps this is where we will let this discussion end today. This nation is spending 17.5% of its total wealth on health care. Our competitors around the world, not including China, which is completely different, but the other industrialized nations of the world, Japan, Korea, the European countries, spend 10% or less of their wealth on health care. In all of those countries, they have universally available health care, different kinds of systems, but it's universally available. We're spending 17.5, they're spending 10. We would think with that additional expenditure, we would be healthier. Unfortunately, we're not. We don't live as long. Our children die earlier. Our women die in childbirth more often. Our health care statistics rank us in the range of the nation of Colombia. This is a tragedy for America and reputation in America. The legislation before us will begin to address that by providing better health care services, as we discussed with the clinics and other reforms that are taking place, access to health care because of the expansion of insurance to some 30 million Americans that don't presently have it, control of the insurance companies, no more pre-existing conditions, no more game playing and discrimination and post-event underwriting, which is you get sick and suddenly your insurance is canceled. Those things are gone. And we're also, in this legislation, controlling the cost of health care in America so that our nation can once again revive its competitiveness so that we spend our money on education and manufacturing and the things that create a strong economy and a strong society with health care. That's our goal. And the great opportunity that you and I have, and all 432, I guess we're down 3 members right now, members of this House and 100 members of the Senate and the President, have is to finally close the gap. Finally, after a century of effort, to provide a system that covers Americans with a health insurance program that has the quality and the benefits that they need. And I know you've been there. Well, you've been there since I first met you in 1976 in California and the years that you've spent here. So, Congressman Watson, it's a great privilege to enjoy and to engage in this dialogue with you.